All right, some men, present company included, would rather clean the bathroom or mow the lawn than go see a doctor. And after a recent study found that men have a lot of reasons or excuses, rather, for not making that appointment.
Yeah, and as June and Men's Health Month comes to a close, WMAR 2 News' Mark Roper spoke with a doctor about what he thinks could help men open up and talk about their health.
Superman's weakness is kryptonite, but for the average man, his downfall often is not admitting he needs to go see a doctor.
They have a bit of a superhero complex with the hope that ailments and issues that they're dealing with will naturally get better with time or be able to get better with just things that they're doing, and may feel kind of a sense of vulnerability coming into the physician.
And Johns Hopkins Bayview Dr. Paul O'Rourke notes it's not just a myth.
A lot of studies have shown that men in particular really seem to have a lot of angst coming to doctors. There was a survey that came out of Cleveland Clinic in 2019 that showed really close to 2/3 of men in that study had stated that they would prefer to avoid going to the doctor.
And even the guys who do pay their doctor a visit don't always tell the truth about everything that ails them. The same Cleveland Clinic study shows 1 out of every 3 men purposely withholds information from their doctor.
It seems like oftentimes it's issues that can be more sensitive. It may be issues related to sexual health or erectile dysfunction. But these are really important things to talk about because we recognize that, this is part of a person's overall health and well-being. And I would really want to reassure men to recognize that these medical issues that individually you may be feeling sensitive about and uncomfortable about are very common.
For some men, avoiding a medical visit isn't just about fear of embarrassment, but a fear of what a doctor may tell them.
They may feel better about thinking that, a lot of these symptoms will get better with time, they'll get better on their own, and being worried that going to the doctor may cause them to face a bad diagnosis or a bad outcome.
Dr. O'Rourke is not only an associate program director at Johns Hopkins Bayview Internal Medicine Residency Program, but an assistant professor of medicine, and he hopes to play a role in changing men's health habits.
Is that a lot of men avoid going to the doctor too because of feeling judged based on their lifestyles or based on the fact that maybe they were avoiding. And one thing I like to tell my own patients, and that I'm hopeful that we're kind of changing within the medical community too, is that you do not need to in any way feel judged, that your physician, your medical team is there to partner with you.
In Baltimore, Mark Roper, WMAR 2 News.
That's real good advice he gave. You know what?
I know.
Yeah, Dr. O'Rourke believes how often a man should see a doctor really depends on family history and individual medical issues. But he recommends that those of you in your 20s or 30s, you have a physical about every other year. Men 40 and up, you got to make a habit of scheduling a physical at least once a year.